What does Kylie Minogue, Sheryl Crow, and Judy Blume all have in common? Well, they all three are breast cancer survivors. About 1 in 8 women in the United States will develop breast cancer during her lifetime. But to put this into perspective, what 1 in 8 looks like, this would be representing somewhat of our class. A lot of you are probably thinking that this speech has nothing to do with you, but trust me, it does. Not only can women get it, but so can men. Breast cancer affects many men and women around the world, but with the right information, we can detect breast cancer early and know exactly what this terrible disease is, its symptoms, how to detect it, and the technologies out there to treat the disease. Breast cancer is something that not everyone thinks about on a day-to-day basis, but they should, and especially should know how to look for its early signs. Today, I would like to inform you about the basic information on breast cancer awareness, its signs and symptoms, and the technologies used to beat this terrible disease. Everyone commonly worries about being diagnosed with some type of cancer, so I'm here to first tell you what to look for and how to be aware of breast cancer. Understanding what breast cancer is and its risk factors. According to the American Cancer Society, breast cancer is a malignant tumor that starts in the cells of the breast. The National Cancer Institute explains that cancer forms in the tissues of the breast, usually in the ducts that carry milk, and the lobules which make the milk. Breast cancer can be either invasive or non-invasive, and there are 2 types of breast cancer, but the ductal carcinoma is the most common type. Knowing the type allows your doctor to choose the best treatment option for you. Invasive breast cancer means that it has spread from the duct or lobule to other tissues in the breast. About 10% of breast cancers start in the lobes of the breast, called invasive lobular breast cancer, and can sometimes be difficult to detect on a mammogram because of the way it grows. But about 80% of breast cancers, called invasive ductal breast cancer, start in the ducts. Non-invasive means that it has not yet invaded the other breast tissue. When it comes to breast cancer awareness, it is important to know the risk factors that increases one's chance of getting breast cancer. It can first be controlled by our lifestyles, but does not mean that your risk for breast cancer can be changed. The first leading risk for breast cancer is being an older female. So in this case, there's nothing you can do other than be educated on early detection. Risk factors that can be controlled include drinking less than 1 to 2 glasses of alcohol a day to limit your alcohol consumption. Another one that can be controlled is being overweight and making sure to get exercise. People that maintain a healthy diet and lifestyle are less likely to develop breast cancer or any cancer for that matter. Having a risk factor does not mean you will definitely get breast cancer, but most women or men have at least one of the common risks, but fortunately most do not get breast cancer. But it's always important to talk to your doctor about the early signs and symptoms. Next, the signs, symptoms, and stages to look out for early detection. The most important thing for early detection is knowing how to do self-breast exams to get familiar with your body, and unless you notice any changes or have a strong family history, but you will not need a mammogram at this time. Most women get them at age 40. But if anything unusual is found, typically a biopsy will be conducted to view the cells or tissues most closely to see if cancer is detected. A lot of times fibroadenomas or other cysts are found and are just regularly checked by ultrasound to make sure they don't need to be removed. It's important to know that there are different stages of breast cancer, just like most other types of cancer. Stages of breast cancer express as a number on a scale of 0 through 4, with stage 0 meaning non-invasive cancers that remain in their original location, and stage 4 being the invasive cancers that have spread outside the breast area to other parts of the body. Stages are important to help you and your doctor figure out the prognosis, the likely outcome of the disease, decide on the best treatment option, and clinical trials that may be a good option for you. Signs and symptoms of breast cancer are important to look out for when knowing you're at risk, and just good to know overall. Some signs and symptoms to look for include a lump in the breast, a change in the size or shape of the breast, dimpling of the skin or thickening of the breast tissue, a rash, inverted nipple, discharge from the nipple, swelling or a lump in the armpit, and pain or discomfort that doesn't go away. The most common symptoms is an unusual lump in the breast, but most breast lumps are not cancer and usually fluid-filled lumps or cysts, or a fibroadenoma made up of fibrous and glandular tissue. Signs and symptoms are definitely something to look at, and if you're worried you may have breast cancer, it's important to know your options of treatment and technologies out there to detect this disease. There is no cure yet, but new technologies are important for a cure. Even though there is no known cure for breast cancer today, there are definitely developments and technologies available for early detection and the best treatment. Technologies that are available today include digital mammograms, magnetic resonance imaging or MRI, and potentially molecular-based detection. Mammograms is the most common form of detection for breast cancer and is important for women 40 and over to get every year. But the main problem with mammograms is a lot of times by the time it's detected, it's already composed of millions of cells and options for treatment are sometimes limited. But digital mammograms is an attempt to improve x-rays, unlike the film digital, will create a digitalized image by still compressing the breast but can be viewed and manipulated on a computer screen. This could better enable tumor detection. Next, MRIs is done for many things and often does not detect cancer. However, for those who may have reoccurring cancer, can be found because it can see through from scarring from previous surgery, unlike mammograms can, or can help a new patient detect cancer whose mammogram, sonogram, and physical exam is not definitive. Lastly, potential molecular-based detection is the use of the gene that can foster breast cancer, and researchers are trying to detect markers of such genetic damage. Mammograms detects based on the structural appearance under a microscope instead of seeing the genetic changes that may have happened. This will help doctors decide if they should treat pre-malignant abnormalities by identifying women who should be screened more frequently. Even though breast cancer affects 1 in 8 women, it is important to always be aware of changes in your body and to check them out regularly. Breast cancer is something that affects many people each year, and not only women, but also men. It is important to know what breast cancer is, its early stages and symptoms for detection, and the technologies that are available for detection. With these new technologies and the understanding of breast cancer and its symptoms, it can be detected much earlier. Since breast cancer isn't yet curable like many other cancers, take a minute and think about those you know who have been affected and be ready to know what to look for if you happen to be one of those 1 in 8